Welcome to ComplyPlus Presents. We're back in the studio for another episode this month. I'm joined, as always, by Dr. Richard Dune. Richard, how have you been?
Been good. Good start to the year. Getting used to the new studio and quite a lot of changes, and the weather's getting nicer, getting warmer.
Yeah, definitely. Yeah, we're through the first quarter of the year now. So yeah, always an interesting time of year, new financial year and so on, lots going on in our business, with our clients, other stakeholders that we work with, price changes. I'm sure everyone will be aware of those.
Yeah.
But yeah, today is a continuation really from last month's episode where we're talking about Train the Trainer. Obviously, it's a model that's used in health and care, in education, in corporate environments, and obviously by independent trainers all across the country and all across the world, in fairness. So what we want to touch on today, last episode, we were more focusing on specific subjects with Train the Trainer, whereas today we actually want to look at the pros and the cons and the reality behind in-house training models. So Richard, let's get the conversation started, I suppose. We did a webinar on this back in October, for those of you that would have been able to attend or did attend or saw that we were doing it and couldn't attend and have seen the replay on YouTube. But we're going to go into a bit more detail today and a bit more the specifics and the mechanics behind some of those pros, behind some of those cons, and behind some of the models that we're seeing out there in the sort of marketplace and in service delivery, and also some examples from some of our clients as well. So yeah, Richard, if we start at the top, why is Train the Trainer so widely used across the different sectors?
Yeah, it's an important conversation, and we have realized that over the years, there's a lot of clarity needed in this area. We've been offering Train the Trainer since 2015. There was nothing really in place, particularly in health and social care. And our own experiences over the past 10 years have actually, made us experts in the area. Because obviously if you're supporting clients who are heavily regulated, you have to link it to the governance framework. And because there was no meaningful governance framework in place, we actually had to do quite a lot of work to bring about governance structures with the organizations that we're working with. Train the Trainer is one of those models whereby it sounds so simple when you think about it.
Yeah, it does. Sounds simple, even when you say the words train, train the trainer.
Yeah, I run a care home, or I'm a nurse, or I'm a doctor. I should be able to train others, right? But in practice, actually, it's incredibly difficult. If you're not careful about it, actually, you expose yourself, you expose the organization, you expose the service users to a lot of risk. And a lot of it comes with how you structure it.
Yeah.
Right. In the first place, we've talked about this in our webinars. We did another webinar this year, by the way, in early March. So we did October, we did March. So we're going to do a webinar every 3 months. But the reason why we keep talking about this is because we can go into more detail. So I want to talk about 3 main problems that come with Train the Trainer. It's popular. There are many reasons why it's popular. Right. We start with the opportunities that come from Train the Trainer. If you train internal trainers, then you get rid of external trainers.
Yeah, or the reliance on
external trainers. That's the logic that many people use. Say, well, I want to train people so that I don't use external trainers. So if I train my people internally, they can reach more people. It's going to cost less. So, scale. If you train internal trainers, you multiply your reach.
Yeah.
It's not as simple as that, and I'll come back to that later on. Then the second one is cost. To say, if you bring external trainers, it's more expensive.
Yeah, you're going to need a bigger budget. Yeah.
Sometimes it is.
Yeah.
Sometimes actually it may not be.
It's false economy, exactly,
right? Yeah. But because we are paying money to outsiders, it looks like it's very expensive. The illusion that it's very expensive.
Yes.
And also, Train the Trainer can definitely be a solution where you lessen the cost. Can definitely be a solution where the long-term cost is significantly reduced. But that depends on several factors. Then the third one is control. If we have our own internal trainers, organizations like owning the training internally. So the resources that are used, how the training is delivered, certification, where you can make adjustments to suit your business and customize. That's really important. And tailoring the training also to their own teams, their culture, and how they can manage risk. It can be very effective. So on paper, it's a very attractive model.
Yeah. But yeah, very attractive. And it does have that illusion, even when you speak to some of the people who are sort of browsing for Train the Trainer or trying to find more about Train the Trainer. It's a lot of companies in this space are trying to sell it like that, aren't they? To say we can reduce costs, we can do this, we can build in kernel capacity and so on. But it's not just health and social care. It's not just health and social care. We do see it across all sectors.
The majority of people who use or train the trainer are actually not in health and social care.
Yes. Yeah,
Unlike all the other workforce development work that we do, when it comes to train the trainer, we have trained people that are in aerospace. We've trained people that are in manufacturing, warehousing, transport, logistics. And it's amazing, actually, that how it's reflected across all sectors, right? Health and social care is an area where it's used quite a lot, because when you think about the traditional way that doctors are trained, nurses are trained, it's an apprenticeship model, right?
Yes, a lot of them.
Right. Of course, nurses now go to nursing school, doctors go to medical school, but then even when they do the theory, then they come into practice to work under supervision. If you're a student nurse or student doctor, you then join a team where you have assigned mentors and assessors clinically.
You're learning off others' experience.
Yes.
Building capacity.
If you look at the NHS model, most of the NHS trusts will have their own internal learning and development departments. So they've got trainers in-house for resuscitation, for moving and handling, for clinical skills. Care homes, more and more are using Train the Trainer. Domiciliary care companies, even recruitment agencies. We used to be a recruitment agency. That's how we started. Then we built a training wing because we didn't want to rely on external trainers.
Yeah.
So that was more than a decade ago.
We followed that path.
We followed that path. Then when you look at early years and education as well, we work with a lot of early years providers. We work with a lot of schools. We've seen them take up Train the Trainer. And it's, early years actually and childcare, it's not dissimilar to health and social care, where people come in as apprentices. People come in wanting to do the level 3 qualification. Maybe they don't have A levels, so they have to do a bridging course. So it's quite popular in early years and childcare, quite popular in education as well. Corporate world, corporate compliance, they have to do a lot of training now around money laundering, quality and diversity, workplace safety, even culture, communication, soft skills,
like that,
so learning development departments. Where it has had the highest impact, and this was my first experience of Train the Trainer, was the NGOs, the non-governmental organizations and the charity sectors, where, I remember in the 2000s, I was working as a nurse then. I started a job in research, and then I took a locum job with British Heart Foundation, and I took another job with what I used to do is I used to do health promotion. So British Heart Foundation, Prostate Cancer UK, all these organizations, I'd go and do what they called health promotion. And a lot of it was you come in with clinical skills, then they train you, they give you this intensive training over a few days. Then you then go and train other people, whether it's members of the public, you're talking to them and educating them, or you are training people that are dealing with vulnerable groups. So it works very well. And even internationally, when you look at the Red Cross, St. John's Ambulance, the United Nations, World Health Organization, Train the Trainer has worked very well, even in small villages where people haven't even got the literacy skills, but you train them so that they can do some work in health promotion or in farming or in places like that. So community programs benefit from Train the Trainer. And this is something that we're going to do as well with the University of Westminster and the Faith Research Network. We co-hosted that event.
Yes.
Where there are a lot of small organizations. We're working with small organizations in London, in surrounding areas, so the northwest of London. And the idea then is, look, there are some people that are doing very well as community organizers, but how do you give them structured CPD so that they can go and train others more effectively? They can communicate health information more effectively. So the appeal is universal. Even banks, insurance companies, we have dealt with banks and insurance companies and manufacturing companies. I'm not going to mention names, but some of the biggest manufacturing companies in this country, we've dealt with them as well. It's an evolving model. Yeah.
Yeah. Excellent. So obviously we're discussing pros and cons today. We'll start with the positive. When Train the Trainer works well, what does it actually look like?
Yeah, look, it's not just a course, because people think I'm going to go train the trainer, and now you can do it online, isn't it? You can just go and pick a train the trainer course for less than £100.
Yeah, and get a certificate
And
on
get
the
a
same day,
certificate
probably.
the
Yeah.
same day. Does it make you a trainer? No, it's a system. When you're building Train the Trainer, yes, there's the theory element of learning how to train others. There's the theory element of learning the responsibilities of trainers and also facilitators, how you facilitate learning in groups, how you facilitate learning in individuals, how you assess people. I mean, you can't do that in a one-day course. Then you're fine to go out there and start training. There are a lot of other things that you need to consider. Yeah. So at best, what good train the trainer looks like is that there's the capacity element whereby you build internal capacity for an organization. So you identify the key people who have the best chance of becoming good trainers. You then actually plan in advance. What does good training look like in your organization? What is the purpose of that training? So the aims of that training, what are the things that you want to change because of the training? Because training can actually make things change in a negative way, depending on how it's delivered.
Well, yeah, and especially if we talk about change management in organizations and so on. If there's a big rehaul or overhaul, let's say, of the training and how it's delivered and who delivers it, yeah, it can have positive and negative consequences. Yeah.
Yeah. So there's that allure for you no longer relying on external trainers, which is capacity issue. But also, if you're an independent trainer, you can learn. Maybe you're an expert in a subject, but you want to learn and gain the skills to be able to train others, to be able to build good aims, objectives, outcomes. Different delivery models. Like the world keeps changing right now. The way we deliver training keeps changing as well. Consistency is the other one as well. When it looks at good training, it's got to be consistent. Training is delivered in a standardized way across teams, because if you are building capacity, there's an organization we worked with. They had several sites in Wales and southwest of England, and we were delivering training to these people who were coming from clinical environments. Some of them were coming from clinical environments. Some of them were working in the factories because they produced healthcare products. Some were in the warehouses. So they're coming with they're in the same organization, but they're coming from different perspectives. You train them in a standardized way because they're working for the same organization, but then you customize certain elements, because the clinical side, they were dealing with vulnerable patients who had mobility issues. Then the factory side, they're moving boxes and equipment. So when you look at manual handling and moving and handling, the theory may be similar, but application is different. When you're moving and handling objects, it's quite different from supporting people who have mobility issues.
Yes.
Same subject, but completely different applications.
Yeah.
Right? So consistency is really important. Then the resilience of a system. We've seen a lot of organizations, you and I have worked with many organizations that start very well, but they just run out of steam.
Yeah.
Maybe the person who was leading the training just loses motivation.
Or leaves the business.
Or whatever, people get overwhelmed as well. They still have their normal job, and they're still required to train others. And
it's normally in those organizations as well, just to add context, that are growing quite quickly.
Yeah.
Because when you're training a small team, you're in control of what people are doing, where their competency levels are, you're signing them off.
Yeah.
But then all of a sudden that team goes from 5 to 15.
It's a different thing altogether.
It's a different ballgame.
Even how you facilitate learning in bigger groups.
In a bigger group,
it's quite different.
How do you keep everyone engaged? It's not the same as doing a small session in a small office room or meeting room that you've rented out. All of a sudden you need bigger room, projectors. Completely agree.
Yeah, so in short, it's an issue of capacity. Good training takes care of the capacity. Good training is consistent, good training is resilient and standardized. And the key is that you operate a joined up model that keeps reviewing your training needs. And we've worked with an organization where we support them to review every quarter. And you're going to get your best results. If you're running a care home that is 100 workers, 150 workers, and you're constantly hiring, because they're constantly hiring, they're losing people. Maybe some people are working part-time. You have agency workers coming in or bank workers coming in. There are always training needs that are needed. And it's not a one-off intervention, because a lot of organizations use it to tick a box to say, we have done the training. And we see those organizations coming back. Some of these organizations, we have worked with them from, a place where they're rated inadequate by the Care Quality Commission. They're nearly shutting down. And then you work with them, spend several months, maybe even years working with them to reverse that. Then they get really good ratings, even outstanding after the next inspection. And then you see them sliding back again. They think because they've got good rating now or outstanding, then they start actually some of the good practices that we've built. It's quite disheartening. And I see that over and over. Every few months you see an organization sliding back again. It's not an intervention. Training is not about getting people in the room, reading slides to them and giving them certificates.
Ticking a box.
Yeah, it needs to be part of the governance framework of an organization. Yeah.
So when it works well, it's actually one of the best workforce development models available.
Yeah, it is. It is when you think about it, actually. You start with your workforce planning, isn't it? As an organization, you are planning your workforce needs. When do you hire people and the induction, onboarding, the supervision. It's a foundation. It's train the trainer is part of the foundational framework, because people don't have to have a full job as a trainer in the organization. If they're responsible for providing induction and in onboarding, you need to train them to be able to do that. Don't just expect that because they know how to do the job, they'll be able to give a good induction. So it's foundational. And also, you find a lot of people in the organization would have subject-specific knowledge, competencies in different areas. Like when I worked in hospitals, right? I remember when we were setting up a clinical research unit, I knew a lot of things. I knew a lot of, I looked at the protocol. I know exactly what I need to do with the patient. I do the assessment for the patients. I take bloods. I know how to, process samples and things like that. But there were certain things that we didn't know. I didn't know how to handle dry ice. I'd never handled dry ice. So we had to go for training with the health and safety team for handling dry ice, because they were the ones that trained people in the labs and all that. We had to set up a centrifuge to be able to spin our bloods and separate the blood components. I'd never done that. So we had to go to the lab where we got a 2-day induction into how to do that. So I had skills, yes. I knew what to do with my patients, but some of the things that I was not required to do, I'd never done them. Yet there were people in the hospital who were doing that every day. So no matter how small your organization is, you have to think like that. Not just one trainer, build a team of trainers with different roles, specific roles. Then standardization, when you look at subjects competence, right? People may have different levels of competencies, but if you standardize how they are supposed to deliver the training, then maybe the one with the higher competencies is one that maybe builds the training materials with support from the others. But then this delivery of those materials has to be standardized.
Yes.
So that people, if one person is delivering or the other, it doesn't really make a difference if they're following a standardized format. And the structured delivery is really important, because nowadays, when we started e-learning in 2013, some people told us point blank, well, e-learning is not really training, is it? People believed in face-to-face training. Up to now, I know a lot of people that believe in that.
Yeah, there still will be believers of that model,
But during COVID, we all had to learn online. We had to use blended learning models.
To use digital tools,
You can do webinars now. You can combine e-learning with self-directed learning. People got degrees from distance learning. So
some of the webinars you attend now are better than some of the classroom things I've done. When I look back to things I've done in my life, whether it's training, workshopping, even networking, some of the online networking things are even better now because they're more engaging. You get more time with different people. So look, some people are stuck in their ways, but the reality is, as you said at the start of the session, times are changing.
The world is changing, and if you get stuck wanting to deliver everything face to face,
like a legacy model, in a way,
many subjects actually I remember sitting for days on end doing mandatory training, statutory training, and people just lecturing at you. And I'm thinking, I can read the slides. I'm perfectly capable of reading the
I
slides.
don't need someone to do it for
Or
me.
I'm looking at it thinking, you just extracted this from a textbook. I can read the textbook. I've got the same textbooks as you do, right?
Like a
So
print
now
screen of
people
a
are more
textbook,
discerning, even students. I think there was a case late last year when students sued some of the top universities, including UCL and Oxford, for poor training,
Yeah, just the standard
poor education, because they were saying, well, because it was during COVID, we learned online, but we didn't really learn, and students had a case, and there was, I think there was some compensation. I can't remember the exact amount that they were compensated. And it's not just here, all around the world. Students are more demanding. So if you're going to train people, it's got to be meaningful training. And most importantly, quality assurance is really crucial. As an organization building internal capacity, you need to think about quality assurance all the time. But even if you're an independent trainer or a training company, quality assurance is important. It's got to be defensible what you're doing, because you can get sued.
Yeah,
you can get sued,
yeah.
right? And when those elements are aligned, then the model is incredibly powerful. And we've seen that with some organizations actually, where every year you go back, things have changed so much, and it's getting better and better. And trainers are motivated, they're supported by the organization, the quality assurance system is working. You can see the change in results, whether it's outcomes for service users, whether it's a production line in the factory, things are getting better, fewer injuries. You can measure training. You got to be able to measure the impact of training as well.
Yeah.
Yeah.
Completely agree.
Mm.
Completely agree there. So from positive now to negative, the difficult part, I suppose, where does it go wrong?
Yeah, I like to take these as learning opportunities rather than negatives. Yeah, it gets interesting because we've covered some of the things where organizations don't prepare very well.
Yeah.
They treat training as an intervention, one-off intervention.
Well, that was our last webinar about readiness, wasn't it? And
exactly.
I think that is always a key component of training the trainer.
Yeah. So we call this in our business cascade dilution, right? Where someone attends a course and they come back, they train others. Just because they've attended a course.
Yeah, they've got the certificate.
They've got the certificate. And then the organization says, yeah, go and train others.
Yeah.
Yeah. You can't do that.
Yeah.
Yeah. And that is the biggest problem. Attend the trainer course, come back, go and train others.
Do it for us. Yeah.
Yeah. Each step, actually, content becomes less effective, less accurate, because you have to be able to say, look, you've gone for training. Now let's look at how you've done the trainer. A lot of companies now will give you materials that you can go and use to train others. How effective are they actually? Are they up to date with the legislation, regulations? Do they meet the organizational requirements? Because we've done that where when we started out, I went and did some train the trainer courses just to see whether there's anything we can learn. Although I had the qualifications already to be able to deliver training to others, I just thought, and I remember living there and thinking, if I didn't know what I knew already, what if I actually benefited by spending 2 days here?
Yeah. A lot of the courses are 2 days, aren't they? Yeah.
That's how we ended up developing train the trainer programs for our own internal use. Then in the end, we ended up giving them to others because we realized actually there are always going to be gaps. So organizations have to customize that. So you see variable trainer competencies. I did mention this earlier, where not everyone who knows the subject can teach it. If you're a subject expert, you may not be the best person to go and deliver training. Or maybe you work with others to co-deliver.
Yeah.
You come and demonstrate skills and assess people, but maybe you're not the best person to deliver the whole program, right? Yeah. And there's no observation or assessment, right? No checks on how training is being delivered. Even as recently as last week, I was talking to a operations director of quite a successful care home group. They don't know what their training department is doing. They've got HR people who are delivering training, and I say, well, so how do you ensure that it aligns with CQCs? Oh, that's their problem. No, but you are responsible. They're saying, oh, that's the problem.
You can't just say that and hope for the best. In a way, yeah,
yeah, but that's the reality.
That's the reality. I know
that's the reality.
That is the reality.
Yeah, and there's no defined scope as well, where people end up teaching things that they are not qualified to teach. So there's no framework to say, look, you are now a certified trainer, approved trainer in an organization. These are the subjects that you can teach. And if you need to go and teach the other subject, you have to go and learn to become a subject expert in that subject. There's very weak quality assurance, but in most cases I've found that there's no quality assurance at all, right? There's no monitoring, there's no feedback, there's no improvement, there's no learning. The business owners or the directors have never sat in a training session or actually looked at the evaluation to say, what did people say about the training, right? And the false sense of compliance where organizations believe that they are covered, but actually they're not. Yeah.
No, completely agree. One of the phrases you mentioned there, false sense of compliance, that's obviously a big statement.
Oh, yes, because you get a rude awakening, don't you, when an inspector comes in, or an auditor comes in.
They completely rip it apart, basically.
You thought you were getting 90 to 100% on certain areas, and you realize actually that marking your own homework, you were giving yourselves much higher marks. So because people from inside actually, it looks fine what we're doing, but somebody from outside, they it's not just whether training has been delivered, right?
No.
They're looking at the effectiveness. You have to deliver training. The certificates do exist. You've got them. The records are in place. But actually, when you dig, you don't even need to dig that deep, right? You find straight away that there's no assurance in place. There's no tackling of risk, actually, because usually a lot of training is designed to mitigate risks. When you look at highly regulated sectors, but actually nothing has been done to do that.
And it is that application of the training as well, because regulators or people coming in to do audits, they can very quickly see whether the training that said has been done, are people applying it? Does it link with policy? Does it link with the SOPs of the business? And I think that's where a lot of people seem to get caught out, isn't it?
Definitely.
So talking of regulators, how do they view train the trainer?
They don't, in general.
That's a straight answer.
No, we have to be honest here, isn't it? You look at Ofsted, you look at Care Quality Commission, there's nothing in place really. Even Health and Safety Executive, there's nothing in place to say, look, these are the training standards that you should put in place. It's one of those areas where there's self-regulation.
It's very misty,
Yeah. You remember when the banks were self-regulating, and we ended up with a crash in 2008. When government reduces regulations, calling it red tape and all that, there are consequences for that. And we're seeing that in training. It doesn't take much. You and I can go and set up a training company and start training people tomorrow. No one is going to check what our backgrounds are.
As long as we've done the stuff with HMRC and Companies House,
nobody seems to care, right? But you are now starting to see some inspectors. I've seen some people, and we've even talked to some inspectors and people at CQC or Ofsted. They're now starting to check actually training records, especially when companies are training people internally. They're now starting to ask questions to say, look, okay, we know that you ran some courses, we know that you've got some certificates, but how do you know that the training is effective? How does it link with policies and procedures? Which regulations is it applying to? What gaps is it filling? Because if you're a healthcare company or social care company, there are clear regulations on what you need to do. You've got safeguarding, you've got safe treatment, you've got good governance, you've got stuff. So your training has to meet some of those requirements. Right?
If it doesn't, it's not effective.
Exactly.
Away,
So how do you know that your trainers are competent? So records as well. So do they do a train the trainer course? What prior experience do they have? And also the quality as well. How do you ensure quality over time? Because they've got a certificate to say they're now covered for the rest of the year or for the next 3 years. But how are you going to ensure that they stay competent? What if things change? Regulations change, or what if there's an incident or accident in the organization, or there's some guidance from local authorities to do things differently? How are you going to cascade that training again? So train the trainer can support those answers, but it's got to be governed properly. So you have to prove actually under good governance, Regulation 17, that there's a system in place. Otherwise, there'll be more questions actually to be asked than there will be answers in that sense.
Yeah, excellent.
Mm.
So it's not the model that they're necessarily concerned about, it's the lack of control around it. Would that be fair?
And that's exactly what governance is all about. What controls do you have in place for these things that you're doing? The quality assurance, the selecting of trainers, the framework around what they can train and what they can't train. You still need to balance all those things. So, when you look at train the trainer risks, it's very informal the way training is delivered in a lot of organizations. Very informal. It lacks the formality actually that it deserves, really.
Yeah.
Right. Because with formality then comes good governance in most cases.
Yeah.
Right.
And the seriousness. Yeah.
Exactly. It's poorly documented, sometimes undocumented, because even some people that are training others, they can't find their certificates if they have them at all. They've always trained people, spent the past 15 years training people, ask them about the new regulations or changes in legislation. They can't tell you a lot of them.
No.
Because they've not gone for any refreshers. They're not going to conferences to hear what's going on. They're not
keeping
joining
up to date,
those webinars that you and I were talking about at the beginning. They've not improved their own knowledge of the
Their own
subject.
development,
Yeah. And it's unobserved. There's it's ungoverned. There is no continuing professional development. Because as a nurse, as a doctor, as a teacher, a lawyer, you're required to do continuing education. But as a trainer,
there's no requirement.
I could be a trainer training doctors. Actually, there's nothing stopping me going to train doctors tomorrow or nurses tomorrow or teachers tomorrow. I'm not training them to be doctors, but I can deliver training to them. But I couldn't possibly sort of show you or prove to you why I'm
able to do
that.
Yeah.
That sounds odd, doesn't it?
Yeah, when you were saying it, I was sort of thinking, now, okay. But the reality is, and even organizations that bring trainers in, I know we did, like we said earlier, the last webinar on readiness, but what a lot of people don't do those checks either to actually look what trainers actually come in to see my doctors or to see my AHPs or my nurses or my dentists, what credentials do they have? Even the business, have you trained people in this sector before? And
due diligence.
Yeah. How many people do that due diligence?
Yeah. Are you accredited? Who's behind the business? Who is the trainer? Because if you're hiring people to come and train your people to minimize certain risks or to improve knowledge awareness or to change behaviors, that's the first thing you should do.
Yeah. It would be.
It baffles me. Absolutely baffles me that no one has time or even feels like it's their responsibility to do that. And that's the challenge that we have as a training provider, where we follow certain ways of doing things. And you end up losing business to cowboys who will promise everything under the sun. What we do in several weeks, they promise to do it in 2 days. And they think, but why do you think somebody can learn, if a nurse takes 3 years to learn about medicines and what they do to people, then they have to get signed off. What makes you think that this person can come and train your care workers to go and give medicines to people after just 2-3 hours training?
A couple of hours training, yeah. It's I think also in a training scenario where you're looking to the facilitator to learn, to improve your knowledge. I'm not saying that the facilitator necessarily has to be more intelligent, but it's that respect in the room as well, isn't it? Because people can spot a bad trainer probably after 5 or 10 minutes of a session very quickly. Yeah.
And then they have to spend the whole day and enjoy the pain.
And have no respect for them and probably switch off and then don't learn. And then there's other issues around that. But anyway, that's a separate issue, but I think relatable at the same time. So if we turn that around, what does good governance look like?
Yeah, look, we've talked about this in previous podcasts and the webinar, but it's identifying people that are suitable to become trainers.
Yeah.
And if you are going out as an independent trainer, really self-reflect, actually. You have that self-awareness to say, look, what am I capable of doing? Where are the gaps? And what do I need to learn to cover those gaps?
Yeah.
Right? So who is the person or people that you're choosing? And, what makes them more appropriate than others, for example, to become trainers? And the second one is educational competencies. It's not enough to just know how to do something. You have to understand the theory behind training others.
Yeah.
Your role actually as a trainer, and how to build training materials that are effective. So building aims, objectives, and learning outcomes, doing a proper needs assessment, or that actually means some educational attainment, which the award in education and training provides as a baseline. And even our train the trainers now, we provide those as a baseline. Whether you have prior knowledge or not, we still cover those things, right? And subject scope as well. What exactly do you know, and what are you authorized to provide? If you are very good, I've worked with organizations where they have a pharmacist, and the pharmacist actually is not the best person to train the people, but they have the subject expertise. So they help in building materials, they help in the training delivery, but they're not the lead trainer. And there's nothing wrong with that, to say you have your lead trainers who are very well versed in, all the core issues around building training, quality assurance, assessment, so that they can sign off things. But you can then have subject specialists, maybe somebody specializes in safeguarding or diabetes or health and safety, fire safety, or whatever the case. Then you have ongoing quality assurance, observing training, documenting it properly, supporting trainers, reviewing training effectiveness. So those are the 4 key elements. And you have to have a training register with all your trainers. You define the permissions as to what they should be able to train and what they can't. And micro teaching also observe them and sign them off, give them feedback, see where they need to improve. It's public speaking, presentation skills, or even clinical skills, or certain equipment, if they need to learn how to use equipment appropriately, or does somebody come in to demonstrate how to use the equipment appropriately as part of the session, then that person is signed off as well to be able to do that. The quality assurance processes have to be documented, starting with the policy and procedures relating to training and development and what risks are being addressed. And then the continuing professional development and refreshers, absolutely crucial. Train the trainer is not a one-off event. You have to build a defensible system where if you were to end up in court, can you defend your system and say why it's effective? Would a reasonable person think that it's effective in your position? If not, actually, then you're going to struggle to justify how you're doing things.
No, completely agree. Everything has to be defensible with this system. So before we close, I think it'd be useful if we could look at 5 key takeaways for any leaders listening or people that have got train-the-trainer models, considering train-the-trainer models. It's always good to wrap up with some memorable takeaways for the listeners.
Yeah. So the first thing is, train the trainer is not a course. It's a system. Yeah. The second one is a teaching qualification, whether it's the award in education and training or whether it's a train the trainer course, does not prove competence.
No.
Right. Then the third one is observed delivery is essential. Observe people, sign them off.
Yeah.
The fourth is scope must be defined and controlled, so that training register with clear permissions documented.
Yeah.
And the last one, the fifth one, is governance and evidence matter much more than the certificate. Those are the 5 key things. If you cannot demonstrate these 5 key elements, you're in a very weak position and it's not defensible. And if you're in a highly regulated sector, you may actually end up in more trouble than it's worth. If you're going to build internal capacity, look after those things. But even if you're bringing outside people, check all those things as well.
Excellent. Okay. So the team have asked me to do a quick fire round today.
Okay, I like those.
So these are 1-sentence answers, by the way.
Okay.
So let's keep them short and snappy. So the first one is biggest mistake.
Treating train the trainer as a shortcut.
Biggest myth.
The course makes me a trainer. I have the certificate. I'm a trainer.
One thing to fix tomorrow.
Create a training register with clear permissions.
What do inspectors care most about?
Evidence of competence and effectiveness.
And lastly, what does good look like?
Train the trainer should be controlled, observed, and continuously assured.
Excellent. So, thank you very much, everyone, for listening today. Hopefully, we've covered the pros and cons of Train the Trainer in enough detail. We've given you some key takeaways there, and also some quick fire answers at the end as well. We will be doing more on this. We do have another webinar coming up in 2 months' time, Be a free event. Please do join in. And our next session as well in this studio will be on Train the Trainer next month. So we very much look forward to carrying on the conversation around Train the Trainer. Thank you very much, Richard.
Thank you, Lewis. Thank you to everyone. See you next time.
Thanks, everyone. Bye-bye.